I'm going to answer some of the most commonly asked questions in my office. And probably the most commonly asked question that we get in this office is how much? How much is something that is so relative. It all depends on how much damage do you have. A lot of patients come in here and all they need is a consultation and some advice of maybe cleaning. That's very cheap. When a patient walks in here and it's a disaster, it can be very expensive. But we don't know what is going on in your mouth. So the reality of it is that we need to see you, and then we can work out a quotation for you to see what is really needed. And once we've done that quotation, there's always various types of fillings that a patient can have. They can have very cheap composite or amalgam fillings, or they can have very expensive fillings, ceramics and veneers and whatever is needed. But the reality is that the patients that can't afford us today, we can still help them and make sure that patients get the best possible advice. They become long-term patients and look after their dental needs in the long term. So the first thing on answering that question, how much, you need to come in, let us see what is going on, and then we'll give you various options of how much. And then you can decide. It is your choice to make that decision. What do you want to do? Another question that we get fairly often, I think with most of the patients, is patients walk in here and they say, just remember, I'm very scared of the dentist. Or they say, I'm very scared that it's going to hurt. The reality is we're just as scared of the patients. We try in dentistry always to manage fear and pain. Those are the two most common problems that we have in dentistry. If a patient is scared, I'm scared that he's going to jump and I'm going to hurt him, so we try and manage it. We need to make sure that the patient gets sedated if we have to. Local anesthesias were discovered by dentists. We know how to manage pain, and the one thing that a patient shouldn't have ever in dentistry is pain. If they floss and they brush and they visit us regularly, pain is not something they're going to experience. The difficult one to manage is fear, and fear can only come with trust. If you visit your dentist regularly, you will learn to trust us, and you will learn that we will manage your fear and we will manage the pain as far as we can. So the quick answer is, will it hurt? Probably not. Will I be scared? Yes, you will be scared, but we will manage it. The third most common thing that we get, I normally start a consultation by asking the patient, what can I do for you? And I think the most common answer that we get is, I want to make them white. The reality is, as common and as easy as that question is, just as difficult the treatment is. If you take a zebra and you throw it in the jig, you don't get a white horse. Patients think that you'll always get beautiful straight white teeth. Bleaching is per se an unpredictable procedure, and it's a procedure that needs to be performed by professionals. You cannot bleach diseased teeth or crown teeth or teeth with gum disease or smokers. You need to have the teeth clean, the gum clean, everything healthy, and then we can selectively go and decide how we're going to turn your zebra into a white horse. We need to go and make sure that every tooth gets bleached to perfection, or in most of the cases when patients have got a lot of neglect, they're not candidates for bleaching, and we then suggest veneers or other type of treatments. The reality is that we still have to see you to make that decision.
Your dentist, your choice.